Hello everyone, my name is Leon Deutsch and I am an instructor here at Kaiser University. I'm also a former medical corpsman with the United States Coast Guard. In this continuing education session, I'm going to talk about some of the most common blood tests that are performed in the physician's office. As medical assistants, we're often drawing blood for these tests, but we don't always know a lot about them or why they are being performed. So we'll cover that today. So just a little bit of history. Many years ago, there was a practice that was often performed by physicians called bloodletting. This dated back to ancient Egypt, where it was believed that removing excess blood and other fluids from the body could restore balance. And so basically, they believed that when someone was sick, if we were able to drain a little bit of blood from them, the sickness would leave as well. It was also widely used in ancient Greece, Rome, and medieval Europe. Barbers performed bloodletting, which was a procedure that involved cutting a vein to drain blood. And they did this for hundreds of years. This practice was common in the Middle Ages and into the 19th century. The barber's pole that you see outside of barber shops symbolizes the blood and bandages that were used during the bloodletting process. The pole itself represents the staff that patients would grip during the procedure. Sometimes you'll also see a thin blue stripe in the barber's pole. That was added later for patriotism. Another interesting fact about bloodletting, this was actually performed on George Washington in his older years. He got sick in the winter. He had been working on his farm and got really sick and got a respiratory infection. He was having trouble breathing. So they called in a few physicians, and one of the suggestions that they had was to perform bloodletting. And they did this over the course of a couple of days. It's believed that they may have drained too much blood from his body and that he died from hypovolemic shock. So of course we know today that bloodletting is not an acceptable process, but we do draw a little bit of blood from a patient through the process of venipuncture so that we can test that blood to help in the diagnosis of the patient's illness. So let's briefly talk about the components of blood, and then we'll get into our first blood test. So if we have a sample of blood, we want to understand that there's both a liquid portion to that blood and the blood cells, which are called the formed elements. So your blood cells are your red blood cells, which are also called erythrocytes, your white blood cells, which are also called leukocytes, and there's 5 types of white blood cells. And then your platelets, which are also called thrombocytes. And then you have the liquid portion of the blood, which is called the plasma. Plasma is made up mostly of water. It's about 90% water. The other 10% are these various substances that you see listed here. A couple of other numbers to remember about blood. In a sample of whole blood, it's about 55% plasma and 45% formed elements. This is just another illustration to show the different components of blood broken up into the plasma and the formed elements. So once again, those formed elements are your erythrocytes, your thrombocytes, and the 5 different types of leukocytes. So the first blood test that we're going to talk about is the most commonly ordered blood test, and that is the complete blood count, often referred to as the CBC. So if you're working in a physician's office and you draw blood, it's very likely that you're often drawing a lavender tube on your patients for a CBC. This measures the number, size, and type of cells in your blood, as well as it tells us about our hemoglobin and hematocrit. So it's going to look at our red blood cells, our white blood cells, our platelets, and it's going to tell us if all of those cells are within the normal limits or within the normal range. Are your red blood cells low? Are they high? The same as your white blood cells. Certain white blood cells, when they're high, can indicate certain types of infections. When red blood cells are low, that could be an indication of one of the many different types of anemia. Some patients also have clotting disorders. They have issues related to how well their blood clots, and the platelet count can give us an idea about that as well. You also have a couple of other numbers that are on the complete blood count, and that's your hemoglobin and your hematocrit. So the hemoglobin is an iron-rich protein that is on the surface of the red blood cells, and it helps the red blood cell to carry oxygen molecules all throughout the body and deliver those molecules to the various cells. The hematocrit is a number that tells us the percentage of red blood cells in a sample of blood. So our hemoglobin and hematocrit numbers go hand in hand. If a patient has a low hemoglobin, they also have a low hematocrit. If they have a high hemoglobin, they also have a high hematocrit. So the physician is looking at these numbers plus a few other numbers that are part of the CBC to try to get an idea of the overall health of the patient. And it can give them clues as to various things that might be going on with the patient. This is very common when patients are just having various signs and symptoms and not feeling well. It's also common to do this as a pre-op blood test. So a week before a patient is scheduled to have surgery, it's common to do a CBC. Or if a patient is just coming in for an annual physical, this is part of the blood work that's done. So in this image, what we're seeing is a sample of some blood results from a complete blood count. You can see that we have our hemoglobin measurement there at the very top of these results. The hemoglobin is 15, and the reference range is 13 to 17. And so that would be the normal reference range for a male patient. For a female patient, it's often a little bit lower, about 12 to 16. So when we look at these different results, we want to compare the column where we have our results with the reference range. You can just kind of glance through at your different white blood cells. Your neutrophils are 50, and they fall in that range of 40 to 80. Now, a little bit lower down, we have the red blood cell indices. These are a group of blood tests that provide information about the size, the hemoglobin content, and the distribution of the red blood cells. So they're part of the complete blood cell count or the complete blood count. And they can help the physician diagnose and understand various types of anemia. So we have some numbers under there, and they have abbreviations like MCV, MCH, MCHC, and so on. Now you'll notice a couple of those measurements are in bold print. Some labs will do that to indicate that the number is out of range. So the MCV, which means the mean corpuscular volume, this is a measure of the average size of the red blood cells. It has a value of 80, and the range is 81 to 101, so it's just slightly low. Your MCHC, your mean corpuscular hemoglobin concentration, this measures the average concentration of hemoglobin in the red blood cells. That one is just slightly high. It's a 37.5 and should be between 31.5 and 34.5. So while it's not your job to really diagnose patients, it is helpful for you to be able to kind of understand what some of these numbers mean, and then also notice how various labs will flag those abnormal results. So this image is just giving us some examples of the various normal ranges for hemoglobin for both adult males and females, as well as adolescents, juveniles, and infants. So as you can see, just like with vital signs, the normal ranges are going to vary based on age. This is just another illustration to kind of help us understand what anemia might look like. So in this sample here on the left, we have a normal blood count. We have a normal hemoglobin and hematocrit. And then notice in the middle how low the red blood cells are. That's an indication of anemia. Now there are many different types of anemia, and we have to do further tests to figure out what type of anemia the patient has. But that's just to kind of give you an overall understanding, kind of a visual of the fact that the red blood cells can be low. Now you've probably also noticed the sample on the far right where the patient has a higher number of red blood cells than normal. That's called polycythemia, which is a condition characterized by an elevated number of red blood cells in the body. This can lead to thicker blood and potentially various health complications. It's often classified into primary polycythemia and secondary polycythemia. And there are various conditions that could cause this. Now the next test that I'm going to talk about is called the lipid profile. So first of all, what tube would we use for that? So this is probably a very familiar tube to you. It has a couple of different names. It's often referred to as a tiger top tube or a serum separator tube. So this tube is a very commonly used tube for various blood tests. One of those is the lipid profile. This test is going to give us an indication of the patient's total cholesterol, their triglycerides, and a few other numbers that can help us understand any type of risk for cardiac disease. So when we draw blood with these tubes, we're going to let the tube stand up straight for about an hour if time allows, and then we're going to be placing them in a centrifuge. And we're going to spin those tubes for about 15 minutes at a speed of about 2,500 RPMs. Once we take the tube out of the centrifuge, it's going to look very similar to this. You can see the kind of a light yellow liquid at the top of the tube. That is the plasma. We now call it serum now that we've separated it. That gel that was at the bottom of the tube is now in the middle, and then the blood cells are accumulated at the bottom. So we're going to perform, actually the lab is going to perform that lipid profile on that serum. They're going to be able to determine how much cholesterol is in that sample. Now this is what a normal sample would look. In one case many years ago, when I was in the military, we had a patient, and when we drew his blood, it looked very much like this. His serum looked like milk. His cholesterol was extremely high, but he also had type 1 diabetes that was not well controlled. So he was not in good shape or in good condition at all. I don't remember the exact number that his cholesterol came back, but it was in the 800 to 850 range, which is very excessive. So that brings us to some of the details of a lipid profile. This is also known as a cholesterol test, and it's a blood test that measures the amount of cholesterol and other fats in your blood. It can help predict your risk of heart disease. So you're going to have a few numbers on your lipid profile. One of them is your total cholesterol count. And for many years, physicians would tell patients, we want you to keep this below 200. In recent years, you may have heard of physicians even recommending keeping it below 185 if possible. So the lower that your total cholesterol, the better off you are. Once you start to go above 200, we really have to start talking to the patient about trying to make some changes to their diet, trying to increase their exercise so that we can get that number down below 200. Depending on how high that number is, the physician may recommend that the patient start on a statin or some other cholesterol lowering medication. Now, you've probably also heard of good cholesterol and bad cholesterol. Your HDL is considered your good cholesterol, and the LDL is the bad cholesterol. That represents the cholesterol that can accumulate in the walls of the arteries, which is dangerous. So we want our HDL to be 40 or higher, but ideally above 60 would be excellent. We want to keep the LDL as low as possible, just like we want to keep the total cholesterol as low as possible. So less than 100 is great, but if we could get it below 70, that would be even better. So much of this is attributed to our diets and our level of physical activity. Another number that you're going to have on this lipid profile is the triglycerides. This is another form of fatty material that's often part of carbohydrates that we eat. And so we want to keep that number below 150 if possible, and the lower the better. So a healthcare provider may order a lipid profile if you have a family history of heart disease or stroke, if you're at risk for heart disease, or you're being treated for heart disease. And they're going to monitor this and see if the numbers are going up or if the patient's able to make some changes that could help those numbers to go down. So these results right here would be an example of an excellent condition for a patient. Their total cholesterol is 151. That's well below that recommendation of below 200. The HDL is 58, getting really close to that goal of 60 or higher. The LDL is 83. That's below 100, which is excellent. And look how low the triglycerides are, 48. This is probably someone who has a very healthy diet and probably doesn't eat a lot of carbs as well, and probably gets a pretty good amount of exercise. So these would be considered excellent results on a lipid profile. Now, another very common blood test that the physician orders is called a complete metabolic panel, sometimes also referred to as a comprehensive metabolic panel. This is a blood test that measures 14 substances in your blood and provides a picture of your body's chemical balance and metabolism. There's also an abbreviated form of this test called a basic metabolic panel. So we have a list of some of the common things that we see on a complete metabolic panel. One of the things that it looks at is glucose, which is your blood sugar. And glucose is your body's main source of energy. So we may see some abnormal numbers on this, which could indicate some of the early signs that a patient might have prediabetes or diabetes. Another number is your calcium. So when we learn about the bones, we learn about the importance of calcium, and calcium is one of the building blocks of our bones. We also need a good amount of vitamin D to absorb that calcium into our bones. But your calcium is also released into your bloodstream, and it's a major component of making sure that your nerves and your muscles and your heart is working properly. Then we have various electrolytes. We've got sodium, we've got potassium, bicarbonate, chloride. These are electrolytes that are electrically charged minerals that help control the amount of fluid in your body. So when someone is having signs and symptoms of dehydration, we'll usually see a decrease in these electrolytes. The sodium, for example, is one of the major electrolytes that has a lot to do with our energy. And so you don't really think about it a lot until your sodium level is very low, and then you will feel depleted of energy. Albumin is the main protein in your blood, and it's made by your liver. So increased numbers on albumin could indicate issues with the liver. Something else on this test that from time to time you'll see that will be elevated are the liver enzymes, the ALP, the ALT, and the AST. So those are abbreviations for longer names. These are enzymes that are made by the liver. And there are different conditions that can cause these liver enzymes to be elevated. Now, earlier we were talking about cholesterol and cholesterol medications. If a patient starts taking cholesterol lowering medications, the doctor will inform them that these can have an effect on your liver. And so every 3 months, while the patient is taking those medications, the doctor is going to reevaluate their total cholesterol count, but they also want to do a complete metabolic panel to see if there's any indication that that medication could be affecting the liver. And one of your earliest indications would be an elevation of some of these liver enzymes. Now the good thing is the medication's not going to destroy your liver in 3 months. So if it is affecting the liver, then the doctor can discontinue that medication and look for an alternative treatment. Something else that you'll notice is what's called the BUN and creatinine. BUN stands for blood urea nitrogen. So these are waste products that your kidneys will normally filter out of your blood and remove from your body through your urine. So when these numbers are high, that's an indication that something might be going on with the patient's kidneys. They're not filtering that waste adequately out of the blood. So this image just provides us with a sample of some results from a patient's complete metabolic panel. You can see things listed there like the glucose count, the BUN and creatinine. There's those electrolytes, the sodium, the potassium, the chloride. We've got our total protein. We've got our liver enzymes there at the bottom. So once again, we're going to receive results about these different components in the complete metabolic panel. If something happens to be out of the normal range, it'll usually either be in bold print, or it may have the letter H next to it for high, or the letter L next to it for low. Now, depending on the type of office you might be working in, you may have several patients that are taking anticoagulants, sometimes referred to as blood thinners. Some examples are Xarelto, Eliquis, Coumadin. I used to work in a geriatric office, and we had a lot of patients that were taking blood thinners. And they often had to have blood tests done to see how well those medications were working. So what does the medication do? It decreases the clotting ability of the blood. Sometimes they're called blood thinners, although they do not actually thin the blood. They do not dissolve existing blood clots. They're used to treat certain blood vessels, heart, and lung problems. So these medications are often given because people have conditions that make it more likely they could develop blood clots. And a lot of times that is related to the heart. So atrial fibrillation, which is a cardiac arrhythmia that patients experience, that's one of the reasons that patients may develop blood clots. Also problems with the heart valves. So for these reasons, patients may be taking Xarelto or one of these other blood thinners. So because of that, we have to monitor how well the medication is working and what's going on with the blood. So often the physician will order blood tests for that. So with certain patients, the physician may say, we're going to do a PT, a PTT, and INR. And so that tells us that they are doing what's called coagulation studies. We probably have a patient who's taking one of those blood thinners. So this is often performed on the light blue tube. And let's just talk a little bit about those tests. So a PT, which is called a prothrombin time, measures how many seconds it takes for a clot to form in a blood sample. Since the results of this test can vary with different labs or different testing methods, your results may be used to create an INR, an International Normalized Ratio. Using this ratio makes it easier for the healthcare provider to compare and better understand the results from different labs or test methods. So the PT and INR test helps to find out if your blood is clotting normally, and it also checks to see if the medicine like the Coumadin or the Xarelto is preventing blood clots and is working the way that it's supposed to. So it's a test to kind of monitor, how is that medication working? Is it doing what it's supposed to? I have seen cases, especially with some of the older blood thinners like Coumadin, where the patient, when they first started taking this, they had to come in about every 7 to 10 days to get this test repeated. And it may take a while for the physician to make adjustments to figure out what the right dose of their medication should be based on the results of these tests. So a PT-INR test is often done along with a partial thromboplastin time called a PTT. A PTT test also checks for clotting problems but looks at different coagulation factors than just the PT test. So once again, it's usually a PTT, a PT, and INR. All of that's going to be performed with this sample that we draw in this light blue tube. And so you're often doing this with patients who either have risk factors for blood clotting or they're already taking medication because of those risk factors and that known history. Now, when we were talking about the complete metabolic panel, we mentioned that there were a few liver enzymes that were a part of that test. So let's say some of those liver enzymes were elevated on the comprehensive metabolic panel. The physician then may want to take a closer look at what might be going on with the liver. So then they'll order an LFT or a liver function test, sometimes referred to as a liver panel. Once again, this is typically drawn on a serum separator tube, a tiger top tube, and it's going to list various enzymes. The liver function tests are a group of blood tests that assess the health and the function of the liver. They measure various substances produced or processed by the liver. So when we think about the liver, we want to think about things like liver failure, cirrhosis of the liver, which can be caused by excessive alcohol use, but you can have people who have cirrhosis of the liver who never use alcohol. And then you also have hepatitis. And there are 5 different types of hepatitis. They all affect the liver. So here we have a sample from a liver function test. We've got our patient's values, and then we've got the normal range. And just glancing at these normal ranges, this particular test, everything is within the normal range for each of these various items on the liver function test. With some of these liver enzymes, they could be slightly elevated from time to time. It's when those liver enzymes are at least 3 times the normal range when the physician is really concerned about something serious going on with the liver. Now, another common test that you see performed is the thyroid panel. So a lot of these tests that I'm talking about, these are tests that we commonly see performed or ordered in a place like family practice, where patients are coming in for various general conditions. And so with the thyroid panel, we're looking at TSH, which is your thyroid stimulating hormone. That is made by the pituitary, which is in the brain. And that hormone travels to the thyroid gland, which is located in the neck, and it sort of wakes the thyroid up, it stimulates it. And then once that thyroid is stimulated, it will produce a couple of other hormones, T3 and T4. So why is this important? Sometimes patients come in and they're complaining of, for several weeks, feeling tired, run down, they don't have a lot of energy, and they can have various types of signs and symptoms. Some patients say they feel cold all the time. Others say they feel hot all the time. Some patients say they're experiencing a lot of lethargy. They're just exhausted and tired and sluggish. Others may be jittery all the time. Some may have chronic constipation, while others have a lot of diarrhea. Some patients may have their hair is thinning, their nails feel brittle. All of these are signs and symptoms that there could be something going on with the thyroid. They may have hyperthyroidism or hypothyroidism. So the purpose of the thyroid panel is to look at these numbers and use them in the diagnosis of some of these different conditions. An underactive thyroid or an overactive thyroid, or if someone is already being treated for those conditions and they're taking something like Synthroid, which is a common medication, this can evaluate or monitor the effectiveness of the medication that they are taking. There's a lot of patients out there that are taking thyroid medications. Now, usually they're also being treated by an endocrinologist. So if you work in the endocrinologist office, you're going to see that this blood test is ordered on a pretty regular basis. Now here we have a sample of some test results on a patient's thyroid panel. And notice that these results are not all normal. You've got your results column, you've got your lab reference values in the middle, and then this particular lab has some comments over on the right. So your free T4 is 1.6, and that is low. It should be between 4.8 and 10.8. Your TSH, it's indicated as being very high. The top number for that range is 6.2, and this patient's number is 20.6, more than 3 times the normal level. So sometimes you will see these very abnormal results on a thyroid panel. These are the kind of documents that you see back in the day when we used paper records. These would come across the computer or the fax machine, and we would place them in the medical record, and then the doctor would review them. But now a lot of these results are coming in electronically, and the physician can pull those results up in the EHR. Okay, the last blood test that I want to go over is the PSA, which is the prostate specific antigen. This is a test that doctors usually start ordering on patients when they reach the age of 50. But in some races, they may start ordering that test earlier than the age of 50 because some races would have a higher chance of having issues related to the prostate. Or if the patient has any signs and symptoms of prostate problems at any age, the physician might order the PSA. This is a blood test used to detect prostate cancer. It measures the level of PSA, which is a protein produced by the prostate, in the blood. So this prostate gland, which sits below the bladder in male patients, and it's sort of wrapped around the urethra, it produces this prostate-specific antigen, and it can be detected in the blood. Now, an elevated PSA level can be a sign of prostate cancer, but it can also be caused by other conditions such as an enlarged prostate, which about half of all men over the age of 50 will experience a benign enlarged prostate. It could also just be that there's an infection in the prostate. But the main concern is that a high PSA level could indicate that someone has prostate cancer. So the physician will often do a prostate exam, and then they'll order this PSA test on the patient. So the physician might do a physical exam of the patient and do a prostate exam, and they may notice that the prostate does feel enlarged, but that doesn't definitively mean that the patient has prostate cancer. So the physical exam is just one part of the overall analysis. Higher PSA levels can suggest prostate cancer or other prostate conditions. Lower PSA levels may indicate a lower risk of prostate cancer. PSA levels can also fluctuate. They can go up and go down over time. And this blood test can be used to monitor the effectiveness of treatments. Typically, your PSA level is going to change as you age as well. And so this is just one of those things that, especially for men, needs to be monitored starting at a certain age or even earlier if there is a history of prostate cancer in their family. Now finally, I want to talk about one other common lab test. It's not a blood test, but it is the most commonly ordered lab test. That's a good test question if you're preparing to take your medical assisting certification exam or even your phlebotomy exam. And that is the urinalysis. This is a very commonly performed lab test. So it checks the urine for various conditions, including urinary tract infections, UTIs, kidney problems, and can also give us signs of diabetes. So it is very common for the physician, when they're ordering some of these other tests that we talked about, to order a urinalysis. So for example, when we talk about pre-op lab tests, that's usually going to be the complete metabolic panel, the CBC, and a urinalysis. So the urinalysis examines the urine for its color, its clarity, the odor, the pH, and various substances. So when we do a urine dipstick, for example, like what you're seeing in this picture, it's going to look for things like, is there the presence of blood in the urine? Blood could indicate things like kidney stones or infections. Is there protein? High amounts of protein could have an indication of the kidneys not working properly. Is there glucose in the urine? If there are high amounts of glucose in a patient's urine, you're probably also going to see a high glucose on the complete metabolic panel. And that's an indication that we may have a patient that's about to be newly diagnosed with diabetes. Ketones are a byproduct of fat or fat metabolism. So there's a few reasons that you may see the presence of ketones in the urine. One could be that the patient has just been on a diet and they've been on a low carb diet, so they're burning a lot of the stored fat in their body. But at the same time, that could be a concern for a young child. We might be concerned they're not getting proper nutrition. Now, ketones in the urine can also be an indication of diabetes as well. We're also looking at bilirubin, which is, once again, it's a product of the liver, and it can indicate possible issues going on with the liver. We may also have white blood cells in the urine, We may have bacteria in the urine, which are indications of urinary tract infections. And the patient would usually present with some of the signs and symptoms of a UTI as well. Microscopically, you may see crystals in the urine, and there may be these things called casts in the urine. And there are various causes of those, and those are not always bad things. But we're usually doing the dipstick urinalysis in the office. You may be doing it manually, like we see in this picture. But a lot of offices also have the urine analyzer machines, where you dip the dipstick into the urine, and then it slides into the machine, and the machine does the test for you. This image is just to provide a visual of the various ranges of colors that you may see in urine on a patient that can indicate different things going on with the patient, everything from normal to slightly dehydrated to severely dehydrated. If you ever see a urine that looks sort of a brownish or even reddish color, then there's excessive blood in the urine, and there are various conditions that could be causing that. And then finally, a sample of a urinalysis and the results. So we've got the results column in the middle. We've got our reference range over to the right. We can see a lot of negatives there. That's a good thing. We want to see negative as much as possible. Now, in this particular sample, we see that there is a 2+ on blood and a 2+ on leukocyte esterase. This patient probably is coming in with signs and symptoms of a urinary tract infection. So we're going to look closer at that. We would send a sample to the lab where they would do a more detailed urine culture, but most likely the physician's going to go ahead and start the patient on some antibiotics. Now, some other things that we notice, they indicate the color and clarity of the urine. The specific gravity is measuring how concentrated the urine is, and that can change throughout the day. There's no glucose, which is good. There's none of those ketones or protein or those liver products. So this is probably most likely a sample from someone with a urinary tract infection. Well, I hope that you found this information helpful. Once again, as medical assistants, we're often the ones drawing the blood, collecting the urine samples, packaging that stuff up. We send it to the lab. We get the results back. We're doing a lot of the handling of the samples and the results, but it helps to kind of understand why these tests are being done. And so my goal was to help you understand when the doctor orders one of these tests, you have a better understanding of why it's been ordered and what the results might indicate. So I hope that you found this helpful, and thank you for taking the time to watch.